What's good, YouTube? I'd like to welcome you to my channel. My name is Jay, and I'm a respiratory therapist. If you are a respiratory therapist student or a respiratory therapy graduate seeking to pass the TMC exam, then you come to the right place. I'm 63 years old. I recently passed the TMC exam and the clinical sim exam, and I want to share my experience with you. I can assure you that if you follow me on this channel, that you will pass the TMC exam on your very next attempt. I want to also welcome you to Respiratory Therapy Essentials for the TMC exam. The only thing we talk about on this channel is information or content related to the exam. I can't teach you respiratory therapy, but I can try to help you get over the hump just a little bit farther. Now, if you are someone who have missed the exam by 1 point or 2 point or 5 point or 10 point, it doesn't matter. You just need a little boost. It's not because you don't know the information. Follow me on this channel and we will get you through the TMC exam. Hey, you got a long, prosperous career ahead of you. What do you have to lose? Listen, the only thing that we're talking about are things that are essential to this exam. I want you to pass it. I want you to pass it now. I know the NBRC exam is a very, very challenging exam, but I believe you can pass it. If I can pass it, you can pass it. We don't have a whole lot of time to waste. So tonight we are starting our first video on ventilator waveform. And if you're ready to go, let's do this. Okay, guys, I'm back and I couldn't stand in front of the board so you can hear my voice. Let's do this. These are the things that you need to know for the TMC exam when it comes to ventilator graphics. There are literally hundreds of graphics that they can show you, but I can assure you that there will be a combination of these on the board that you will see on the exam. Number one is simply a patient triggered breath. It is represented by a large fishtail, also called an assisted breath. What you need to remember for the TMC exam is to increase sensitivity. Number two is a football that has a flat line on the baseline. Keyword flat on the baseline, add peak. Number three is a bird beak. Very popular on the exam, represent over distension. To correct it, decrease the tidal volume, decrease the pip. There is one ventilator graphic. I don't know if you can see it. We're going to try to focus it in down at the bottom. Is a spontaneous breath, which is normal. Every now and then, NBRC will want to throw that in on you. Number five is a football with an incomplete loop or hole in the loop to represent a leak. Whenever there's a leak, check your ET tube, check your water traps, check your ventilator circuit, and without a doubt, check your chest tube. Usually that's where the problem would be, in your chest tube. Number six is the low compliance loop, the dotted graph that is laying down, keyword, representing stiff lungs, as in ARDS or RDS. To correct this problem, you need to give the patient PEEP or increase the PEEP. And our graph on number 7 is represented by a sawtooth or stair step. And then there's another one that looked like a scallop that we could focus just a little bit. There you go. It's a scallop looking, but the main thing is that it looked like a sawtooth or a stair step. And these are secretions in the airway. And the solution to this is simply suction your patient or drain the ventilator circuit. Number 8 is very popular on the exam, which is auto PEEP or dynamic hyperinflation, represented by the black mark where you see that the patient began breathing again and begin inhaling again. And this also represents air trapping. This is air trapping and it's not good for the patient. So to correct this, you need to increase PEEP inspiratory pressure. You can decrease the rate, you can decrease inspiratory time, or you can decrease the IE ratio, which will all correct auto peak. The next graph is patient ventilator asynchrony. And if you see the black arrows pointing at what I call P-wave looking things, just recognition, people, just recognition. If you can recognize that they look like little P-waves on the exam, you do just fine, because this is patient ventilator asynchrony, which actually means that the patient is out breathing the ventilator or pressure dropping during inhalation. To correct this, all you have to do is increase the flow. Now there's another graph all the way at the bottom, which is number 10, which is a pancake looking waveform. We'll talk about this later on in other lessons, which is a fixed airway obstruction that you would normally see during cancer patient. Okay, guys, there you have it. Screenshot this board, learn what they are, learn how to correct them, and you'll do fine when it comes to ventilator waveform on the TMC exam. Hey guys, I'm back. Well, there you have it. Ventilator waveform essential for the TMC exam. Now, I can assure you that you will see a combination of these waveforms on the exam. First of all, recognition is one of the key things. Keywords is another key thing. And then just go for it in the correction. You will see a combination of these on every version of the TMC exam. Now, I'll see you in another week. But before I go, listen, I'd like you to hit that like button and subscribe to my channel. Hit the notification bell, turn them on, because I'm going to be dropping 1 or 2 videos every week with respiratory therapy essential for only the TMC exam. And if you stay with me, I can assure you, you will pass the TMC exam on your very next attempt. I'll see you in a few days.